Hi, welcome everyone to our COVID-19 vaccine yarning session for the Aboriginal community here in Victoria. I'm so thrilled to be your moderator for this session today, and we're joined by an amazing panel. For those of you that I've not had an opportunity to meet, my name is Nicole McCartney. I'm a proud Yorta Yorta woman and have the distinct privilege of being the Chief Aboriginal Health Advisor in the Department of Health. As is appropriate and our ways, firstly, to kick us off, I'd really just like to acknowledge country wherever we may be and pay respects to elders past, present and emerging, and really thank all of you for your ongoing commitment and service for our Aboriginal community. So once again, thank you all for joining us tonight in this digital space and to have a yarn about the COVID-19 vaccinations, which I know has been a pretty hot topic for our community. We're excited to be able to create this space to share information with you about these vaccines and the rollout here in Victoria. There has been a lot happening in the COVID-19 vaccination space, and I am sure you will have a lot of questions for our panel this evening. And if you have any questions for the panel, please write them in the Q&A feature you should be able to see to the right of your screen, and we will aim to answer as many questions as we can this evening. We apologise if we can't get to your questions, and we'll certainly aim to post some links to assist in providing information throughout the evening. We'll also work with our colleagues over at VACCHO about how we can communicate any unanswered questions. Back to you. So tonight's main speaker will be Professor Ben Cowie. So Professor Ben Cowie is an infectious diseases physician and epidemiologist at the Royal Melbourne Hospital and the director of the WHO Collaborating Centre for Viral Hepatitis at the Doherty Institute. In addition, Ben is a medical epidemiologist with Communicable Disease Epidemiology and Surveillance, Victorian Department of Health. He serves on a range of communicable disease, clinical and public health committees at state, national and international levels. Since 2020, Ben has been seconded to various roles to support the Victorian response to the COVID-19 pandemic. From January 2021, Ben has been seconded full-time to the Victorian Department of Health to support the implementation of the COVID-19 immunisation program as Executive Director, Engagement and Partnerships. We also have some other fabulous panel members this evening. We have Aunty Jill Gallagher, who I'm sure is familiar to many of you. Aunty Jill has spent the past 20 years advancing Aboriginal health and wellbeing.
I would also like to continue on where Nicole unfortunately left because of connection difficulties, continuing to discuss Aunty Jill Gallagher, who's here with us tonight. A really highly respected Aboriginal leader and advocate for self-determination outcomes in the Victorian Aboriginal community, and a former Victorian Treaty Advancement Commissioner. In 2013, Jill was awarded the Order of Australia, and she's also an inductee of both the Victorian Honour Roll of Women and the Victorian Aboriginal Honour Roll. So fantastic to have Aunty Jill here with us tonight to really give the panel her expertise and her wisdom. And also joining this evening, just checking to see if Nicole's rejoined us again, because I don't want to steal Nicole's thunder. She's much better placed to do these introductions than I. But I will proceed. Doesn't look like she's here with us. Is Dr. John Gillies. Dr. John is a trained GP, currently working for VACCHO as their public health medical practitioner. He also works at 2 other practice locations around Melbourne, including the Boonwurrung Health Service, and I'm currently speaking from Boonwurrung lands, and also the Richmond Medical Clinic. Matt, I don't know if there's anything else you'd like to say on Nicole's behalf before we move on, but it'll be obviously great to get things going, and I hope Nicole's back with us really soon. Matt, I think you're muted, unfortunately.
Thanks a lot for that, Ben, and sorry for the technical problems. Matthew Lloyd, Deputy Chief Aboriginal Health Advisor for the Department of Health, and I think we'll move now into Ben giving a presentation on the COVID-19 situation, and then we'll be able to open up and hear from the other panel members before throwing over to the broader forum for anyone around Q&As. So I encourage everybody to really ask those questions that you might be talking around with the community at the moment, and making sure that you don't leave this forum with any unanswered questions. I think we've put together a really good group of people that will be able to answer all those questions that people might have, or any concerns that have been highlighted in community. So without further ado, I'll throw over to you now, Ben, to move into your presentation.
That's great. Thanks so much for that, Matt. And look, I will get going with my presentation, and I'm sure Nicole will be back with us soon, and really looking forward to moving on with the panel discussion, which obviously will be really interesting. But before I start presenting, I'd like to more formally acknowledge that I'm currently on Aboriginal land. I live on the beautiful lands of the Bunurong people of the Kulin Nation, and I'd like to acknowledge their elders, past, present and emerging, and acknowledge all of the Aboriginal people here present on the call tonight. Thank you so much for joining us, and I'm really looking forward to your wisdom and guidance as we talk through these issues. I'm now going to start presenting my slides, and there might be a little delay as that comes up. So hopefully that's presenting now for everybody.
Yes.
Great, thank you. So really looking forward to having a proper yarning session, which means not just me talking at a computer, but hearing other people's voices, other people's opinions and other people's perspectives. So I'll just set the scene by working through some of these slides. So it's important to remember that this vaccination program, which is being rolled out around the country, is being led by the Commonwealth Government. But here in Victoria, our implementation of this program really is guided by these three pillars. And the first is really a critical one, which is that we need to have access for all Victorians. These vaccines are free. They've been made free by the Commonwealth Government. But we also need to make sure that all Victorians can access vaccination somewhere that's convenient, somewhere that's easy to get to, somewhere that's close to where they live, or as close as possible. But it's not just about geography. We've also got to make sure that access is appropriate and respectful, so that wherever someone's getting vaccinated, they can choose a place that they feel is culturally safe and respectful of their needs, and that all of the services being provided are appropriate for the communities they're serving. And that's obviously of particular relevance as we're speaking about the Aboriginal and Torres Strait Islander communities tonight. Secondly, we have to have absolutely highest levels of safety and quality, no matter where someone's coming to get vaccinated. Because without that commitment to safety and quality, people will have ongoing concerns and hesitancy about the vaccine. And the events over the last couple of weeks, which I'll talk about some more towards the end of the presentation, have obviously undermined or reduced the confidence of a lot of people in these vaccines. And that's something we can talk about. But we've got to make sure that people understand, that all Victorians understand, that our commitment to safety is absolutely paramount. Because without that, we won't be able to build public trust and confidence in the program. And so we really want to be clear and accurate, but also communicating in a way that people can understand and that they can relate to their own personal experience. And that has to be done on a local level and has to be done with respect for the communities that we're serving. And I'm looking forward to hearing some advice and perspectives on how we can do that better going forward. So as I've mentioned, this is a Commonwealth program. It's the Commonwealth who have bought the vaccines. It's the Commonwealth who have signed the contracts, have sorted out the phasing of the different groups who are coming forward for vaccination, and are delivering the vaccines to ACHOs, to GPs, and to the state and territory hospitals and other programs. But we think the Victorian Government has a real role in making sure that we have that fairness and equity in terms of access to vaccination. And that's why we're commissioning additional resources. We're trying to fund different organisations to get the message out to their communities about the vaccine, and really trying to ensure that we're backing up the rest of the vaccination program so that we have different points of access for people if they choose to take them. And I can talk a bit more about our high volume or VIC Icon sites, which are opening up their doors to more Victorians tomorrow, which I'd be happy to talk about. But ultimately, any level of government is just supporting acts. And I guess the three really critical groups here are the expert healthcare workers who are actually giving the vaccines. It's the members of the community who are coming forward to get vaccinated. And it's community leaders, including health leaders and other really leadership positions in the community, who are there, maybe not putting the vaccine into people's arms, but are there to put the right information and trusted sources of information into their community's hearts and minds. And that's what I'm really looking forward to discussing tonight as well. So this is a slide from the Commonwealth Government, and the numbers here are looking at the Australia-wide picture. We're currently in phase 1A and 1B of the vaccine rollout. And that's one important point I wanted to make. As you can see from this slide, the phases overlap. It's not like we finish every last person in 1A and only then start 1B. They do overlap. And also, people might enter these different phases depending on, for instance, if they get a job as a healthcare worker, then they enter into 1B. So these groups do change, and they'll sort of come and go over the course of the year. But it's our commitment to try and vaccinate every Victorian that chooses to do so as quickly as possible. And we hope to do that over the course of this year. But clearly, there's been some issues with vaccine supply, which we can talk about, that's going to make that a bit harder than what we thought it would be. Really did want to make a clear point here that Aboriginal and Torres Strait Islander people aged 55 years and over are eligible right now under the Commonwealth's program in phase 1B, and that all other Aboriginal and Torres Strait Islander people are eligible from the next phase, phase 2A. But one really essential point is that Aboriginal people, Torres Strait Islander people who belong to these other groups, such as people with underlying medical conditions, may be eligible right now as well. And we can talk about those details and how the different eligibility criteria fit together later on, if that's of interest. So up to last night, we had delivered 168,000 doses of vaccine through the state-supported program. Clearly, our GPs and ACHOs and other groups have been delivering more over and above that, which is fantastic. One good thing about this slide is that the numbers are starting to tick back up again. They took a bit of a hit over the last couple of weeks following the concerns about the AstraZeneca vaccine. But these numbers are starting to increase. And again, we're starting to vaccinate more people with the first dose than we are completing with second doses again. So there are signs that people's confidence is starting to return, which certainly makes me happy. So one really positive thing about the AstraZeneca vaccine is that apart from the fact we're getting a lot more doses of it, it's also able to be kept in normal cold chain conditions, the sort of conditions that we can keep our other vaccines, like the flu vaccine, in. Whereas the Pfizer vaccine, the other one, has to be kept really ultra cold, and it has other problems or complications with how it can be sent around and distributed to other sites. So the AstraZeneca vaccine means that we can actually have more different options for where people can get vaccinated, clearly through ACHOs and general practices, but also through the health services, hospital hubs, but really starting to think about some more innovative ways of delivering to people if that's appropriate for them. The high volume vaccination centres, like I mentioned, mobile teams are starting to be implemented through some community health centres, and indeed the community health vaccine network. So a range of different models so that wherever someone chooses to get vaccinated, they can do it in a place that's most appropriate for them. Now, this map of Victoria is divided up into the different local public health units. And these local public health units are pretty new. They've only come into existence in the last few months of last year. They were designed to try and address some of the lessons that the COVID pandemic taught us about the need to have public health at sort of the public health structures closer down to the local level. And I think few of us would argue that having a better connection between what the state can give in public health with the communities that the public health system serves and with the healthcare workers and obviously the Aboriginal community controlled health orgs in that area, other health services and GPs is a good thing. But it's going to take some time for them to actually be able to realise their full potential, obviously. But this regional approach, these local public health units, are how we're trying to coordinate the vaccine rollout over the coming months. And so we might see increased connection between these hubs and their catchments in the vaccine space that we hope helps build those relationships to go forward, not just for COVID, but for public health more generally. Now, I've mentioned our high volume or VIC Icon Centres already. Now, these are already up and running, and the ones that are running currently include the Heidelberg Repat, run by the Austin, and Sunshine Hospital, run by Western Health. Then also the 3 sites that have been taken, that are being controlled by other health services. So the Convention and Exhibition Centre, or Jeff Shed, is being run by Melbourne Health, and the Exhibition Building by St Vincent's, and the old Ford factory run by Barwon Health down in Geelong. Macua in Ballarat is also up and running, being run by Ballarat Health. And the showgrounds are soon going to join as well, with some more sites to be announced in the next couple of weeks. The reason those under the activated sites, the Convention Centre, the Exhibition Building and the Ford factory are mentioned there, is because as of tomorrow, they will accept anyone who's eligible for phase 1A or 1B. And that includes some people, such as people over the age of 70, or clearly Aboriginal and Torres Strait Islander people aged 55 and over who choose to go there. They can ring up and book through the hotline, or they'll be accepting walk-ins as well. This is not meant to replace any other aspects of the system, including GPs. These are really intended to be there to help augment or to build on what other sites can do, and to try and get as many eligible people vaccinated with the AstraZeneca vaccine as we can. Now, these slides are pretty detailed. I did want to leave them here, and I really appreciate the team who's pulled them together. This is a really significant issue, and it's something that I'm sure we'll have some questions about in the panel discussion. And this is that as of about 11 days ago, on the 8th of April, the Australian Technical Advisory Group for Immunisation, or ATAGI, made recommendations about the AstraZeneca vaccine, saying that in fact the Pfizer vaccine, the other vaccine, is preferred for people aged under 50 years. Now, the reason they did that was because of the association or the connection between the AstraZeneca vaccine and a really rare but serious clotting problem. And when I say really rare, we're talking about one person affected for about every 200,000 people who get the vaccine, and it's only on the first dose. So if people have had the first dose and they've been fine, they can go ahead and get the second dose no matter what age they are. But this has led to us needing to pause the rollout to think about how we can do this in that really safe way that we want to run everything. And so basically it does mean we're going to need to be able to give Pfizer to everyone under the age of 50, but there's not many doses of Pfizer available to do that. So people under the age of 50 can still choose to get AstraZeneca if that's what they want to do, after they've had a chat with their doctor, their Aboriginal health worker, their other health practitioners, to have a chat about what's best for them based on their own personal circumstances. But because the amount of Pfizer in the country is so limited, it does mean that this is going to push out vaccination of people under the age of 50 significantly. That's part of the reason we really want to get everyone over the age of 50 connected to getting AstraZeneca as quickly as we can, so we can protect our community as best we can while following the ATAGI recommendations. So this is a really rare side effect, but it's serious. So far, it's been very strongly associated in 3 cases here in Australia, and possibly a 4th, which puts it at around about, 1 in every 200 to 300,000 people vaccinated, because we're getting close to vaccinating around 1 million people with doses of AstraZeneca. And so that it is rare, but it is serious. We can talk a bit more about it, but essentially it's still recommended because all those cases in Australia have been aged under 50 years, as have most of the cases overseas. The advice is that essentially people over the age of 50 can go ahead and get AstraZeneca, and people under the age of 50 can choose. And we can talk a bit more about that in the Q&A, because people will have questions about that, and I think that's absolutely fine. People should have questions. So from tomorrow, as I mentioned before, the Health Minister, Minister Foley, on Sunday announced that the 3 high volume sites, the VIC Icon sites I mentioned, will open their doors to anyone who's in phase 1A or 1B. And people, for example, people aged over 70 who want to book it, or any of the other groups, can go ahead and call that hotline number and book in to get vaccinated, or they can visit that website. But I really want to make the point again, this is not replacing the other really trusted elements of the health system, and particularly for the audience tonight, the Aboriginal community controlled health orgs that are doing vaccination of their community. Number one best place to get vaccinated if you've got an ongoing relationship, or if you're potentially a new patient, because they're the ones who can talk you through your own personal circumstances, and they know your health better than anyone else apart from you. And same thing goes for GPs. If you've got a regular GP who's doing the vaccination, it's the best place to get vaccinated. But these are really additional options for people who might want to choose them. So we are facing some challenges with the program at the moment, that's fair to say. I think particularly the middle one here about the whole Pfizer versus AstraZeneca question is a really live one, and one that comes up quite a lot over the last couple of weeks in particular. So really happy to discuss that further. Essentially what I will say though, this side effect that's got everyone worried is very rare, and the AstraZeneca vaccine is still really safe for the vast majority of people. And so what we're trying to do is balance that serious but very rare side effect against the risk of more people getting COVID in Victoria, and of having significant amounts of people losing their lives to this virus, and having all of the on-stream effects of that on their loved ones, on the health system, and on our community being able to be open and free as we've earned, because every Victorian has worked so hard to get where we are today. So a couple of final quick points. I don't want to go over time because I really want to have more time to chat actually. Firstly, our immunisation program has made available some community engagement grants targeted for Aboriginal community controlled health organisations. Really the aim of these is to raise awareness, to help ACHOs to engage their communities around the COVID-19 immunisation program, and really sort of supporting their role as really trusted sources of information for their communities, because people trust their ongoing healthcare workers, whether that's the nurses, the Aboriginal health workers, Aboriginal health practitioners or GPs. And so really what we're trying to do is to give resources to those fantastic workers to be able to engage their communities. And so these are still open for a couple more days. They close on Friday. So if you're an ACCHO who hasn't applied for this, get your skates on, because we'd really love to work with you to help your communities in this way. And the other thing I did want to make a quick point about was, I believe next Wednesday, the Murdoch Children's Research Institute is being supported by, again, us at the Department of Health, to run a range of these confidence building sessions. And the idea of these is it brings together experts from community, along with some of our expert researchers, to find the best ways to give credible and trusted information to our communities. The one specific for Aboriginal and Torres Strait Islander health and community leaders is being held next week, and really is meant to be there to help address some of the misinformation that is circulating in our communities, and really happy to discuss that further as well. So that's my last slide. Thanks so much for the opportunity to present, and I'll hand back to, if Nicole's back with us, I'll hand back to Nicole.
Thanks so much, Ben, for that incredible suite of information that you've provided. I think before we go into the Q&A session, and please remember there is that Q&A function to the right of your screen, so please pop any burning questions that you have in there. But before we get to that, I might now throw to Aunty Jill Gallagher.
Thanks, Nicole, and Ben, thank you very much for your very informative presentation. I'm not going to talk for too long. I'm just basically, before I do begin, I'd like to acknowledge that we are on Aboriginal lands and pay my respects to elders past and present. I don't have a lot to say. I know a lot of the Aboriginal community-controlled health services are administering the vaccine, sprinkled across Victoria, and Jonathan might be able to talk a bit more about that in detail. But it's unfortunate that the mistrust is growing in the community. Some of the things that I'm hearing within the Victorian Aboriginal community is some of the things Ben has already sort of flagged, the mistrust, and it's really not so, and I don't know how we address this, but it stems right back from when the Commonwealth Government first purchased the vaccines, and the vaccines, you know, having two, the Pfizer, which, and I don't know whether this is true, I'm no expert, but there are myths out there that probably do need to be dispelled. Is the Pfizer is a more expensive vaccine as opposed to the AstraZeneca being the cheaper option. So that mistrust stems right back from then. So our task, when I say our task, the Victorian Aboriginal community task and governments, is how do we instill confidence in the sorry, I just saw, yes, I just saw people walking behind you, Ben. That threw me off. So how do we, as our service system, develops that trust with our own peoples? Not only with the recent death of a woman under 50, having the AstraZeneca, but also with the trust in whether the AstraZeneca is a cheaper option, therefore is not as good as the Pfizer. That's, I think, our biggest dilemma, and I think that's the challenge we need to talk about within the community.
Great. Thank you so much, Aunty Jill, and really appreciate you bringing that perspective to the conversation. So I think now I'll just throw to Dr. John Gillies to see if he'd like to share any opening comments before we get into our Q&A. Thanks so much.
Sorry, you're muted, John. Sorry.
Sorry, everyone. Real pleasure to be here tonight representing VACCHO along with Aunty Jill. We have 22 ACOs across the state, which are currently vaccinating our communities, which is just awesome. Myself and Melody Cameron, who I work closely with as part of the public health unit at VACCHO, have called around to most of them, and we know we have extremely self-sufficient, strong, well-led ACOs, and they're just doing an awesome job. I think all of Aunty Jill's comments are spot on though. We know there's a lot of vaccine hesitancy, and I'd be really interested to know what the community thinks are the best answers to this challenge, and looking forward to the questions and answers to come. So thanks, Nicole.
Great, thank you so much. So we have had some questions that have come through, and some of them may be a little tricky, but I think we've got a great panel that can do their best to certainly assist us. Look, maybe just to start, one of the things that seems to be coming through certainly very strongly in my conversations, we have a really fabulous Aboriginal health workforce, and I think they've done a brilliant job throughout this entire pandemic. And obviously family is really important to us, and so I think there's been some concerns from particularly our Aboriginal health workforce that are a little concerned that obviously by being vaccinated that may impact on their fertility and obviously their ability to have a family in the future. So I'm just wondering, I guess maybe starting with you, Ben, in terms of what sort of we know about the impact of the vaccination on fertility, particularly for those of our really staunch Aboriginal health workforce. Thanks.
Thanks so much for that question, Nicole, and it's a really, really important one, so I appreciate the opportunity to work it through with you. So the evidence both from overseas and as recommended by our Therapeutic Goods Administration and also by ATAGI here in Australia is that neither of the vaccines available here, and in fact no COVID vaccines globally, have an impact on fertility. So they won't in any way cause problems for a woman who's trying to become pregnant. They're also been recommended as being safe for women who are breastfeeding also. So they're safe in women who are breastfeeding, they're safe in people who are trying to get pregnant. What we don't know at this stage is if they're safe for women who are currently pregnant. And so the guidance, sorry, I think my son's printing something on the printer next to me, so sorry about the background noise there. What we don't know is that they are 100% safe during pregnancy. We've got no evidence that they aren't safe, but out of a complete sense of caution, until we have more evidence to say they're safe in pregnancy, it's not routinely recommended that people go ahead and get vaccinated with either of these vaccines during pregnancy. But for, like I said, no impact on fertility. Women who are trying to get pregnant can go ahead and get vaccinated, and so can breastfeeding women.
Brilliant, thank you so much. I think that's really informative, and I know it's certainly been front of mind for many of our women, and we have a very large female workforce in our community. Another burning question that has certainly come through is particularly for those in community that have chronic conditions, of which we know there is a large number in our community that have a range of chronic conditions. And so I think there is some concern there about getting vaccinated. I'm just wondering, Dr. John, whether you have any thoughts on that, and certainly the advice we can give community around that.
Yeah, great question, Nicole. You're right. A lot of our community members would qualify under the medical conditions criteria as 1B, but they would be under the age of 55. So I think it really comes down to discussing that with the doctor or Aboriginal health worker or practitioner who knows you best. And first of all, working out whether you do qualify. And then if you're under the age of 50, of course, having that step 2 of the conversation of whether the risks of potentially getting COVID, if we have outbreaks again, is how that weighs up against the risk of clotting. And as Ben said, the risk is extremely small, about 1 in 200,000, but it deserves a thorough conversation with your health professional that you know the best.
Great, thank you so much for that. So in community, we know there's lots of conversation going on, and usually we kind of talk amongst ourselves and kind of make a decision as a family and a community. And certainly the concerns that I guess we have around vaccination hesitancy. I'm just wondering, Jill, whether there's any thoughts and comments that you would make in terms of I guess really in our families. I think we go back to our families and our communities. Certainly, you know, I guess how we might sort of have an open and honest conversation about vaccination and perhaps get people thinking about it a little more.
Thanks, Nicole. Look, you know, we usually come from large families within the Aboriginal community. Very large families, so I think sometimes that's a benefit, although sometimes it could be not so good. But it could be a benefit. And so having those conversations, and this is where I think our services need to target not just individuals but families in relation to maybe dispelling those myths, having conversations with whole families. It's really important that, you know, usually there's a couple of leaders within a family that other family members look up to, and it's that leadership that Ben spoke about very early on. You don't have to be the Prime Minister or the Premier to provide leadership. You know, we have a lot of leaders in our communities, well-respected leaders in our communities, but more importantly, well-respected leaders within our families. And I think that's really important, that's where the Aboriginal health services start to tackle that. And that's your avenue for those conversations. I think it's vital that we do that, and that's a bit of a target for that. But can I ask a question of the two doctors in the room? Is that allowed, Nicole? I just want to ask a question that I'm also hearing in the community. If you have the AstraZeneca and you're the unfortunate one that might develop blood clots, does it automatically mean you're going to die?
I'm muted. I'm off mute now. Maybe I can start, and then Jonathan, please do come through and give your perspective as well. Look, the answer is absolutely no. It doesn't mean that. While we're still working out if that really tragic case of that lady was caused by the AstraZeneca vaccine, the lady who passed away, We know that there are other cases in Australia, so 3 cases that have not passed away. We understand that they're recovering and they've clearly been very ill and they've required treatment, but they are recovering. And so I think that reflects what's been seen overseas, is that most people don't lose their life, and the loss of life might be around about 1 in every 5 people who get these clots, based on data from the United Kingdom. That's still really serious. I'm not trying to minimise that. No one wants to see that. And, you know, everyone here is in the business of looking after people's health, right? And the last thing we want to do is, while we're doing that, is to put people in harm's way. No one wants to see that. But it's a really good question, Aunty Jill, and it is absolutely the case that most people who get these clots make it through with the appropriate treatment, and we're training our GPs on what to look for. And maybe I'll let Jonathan speak to that, about, you know, what the symptoms are and how people can be aware of what to be worried about and what's just a normal vaccine side effect.
Thanks, Ben, and thanks, Jill. That's a really good question, and it's one I get asked quite a lot working as a GP. But if people have the vaccine and then they know what to get medical attention for, as Ben said, the death rate is very low from these clots, from the data we understand so far. So the main thing that we tell everyone when they get an AstraZeneca vaccine is that if they get a severe headache that isn't relieved with Panadol from day 4 to 20 after the vaccine, that requires urgent medical care. They might get severe tummy pain or neurological changes such as vision changes or balance disturbance, but the main symptom seems to be a headache from day 4 to 20 after having the vaccine. That's serious. Get urgent medical care. And if you do that and you pick it up early, chances are really good that you would survive, even though it's a serious condition. We have really good treatment for those clots. So that's a really important message. And I don't think we're getting that message out very well through media and community channels.
Great, and absolutely, Aunty Jill, you can ask any questions you like. I think the more information we can get out there, the better. I think just extending that a little bit further, I think just to clarify again, what exactly are those, what are the usual symptoms from a vaccination that community can expect? Because I think that's the balance. They're not sure if something's or not. And then, of course, once someone feels like they've had a bad response, they share it with those very large families that we all have. So just wondering, back to you, Dr. John, if you're happy to answer that question.
Thanks again, Nicole. And I think we should also add, we might put out some written I don't know, materials at the end of this to just put it all in writing, what we're about to say. But the common side effects, so this is especially in the younger age group who were getting the AstraZeneca vaccine, really common to get fevers, muscle aches and fatigue. And that would usually start after about 24 hours or within the first 24 hours and could last a few days. So a bit like a common cold-like reaction. And as long as it's in the first 4 days, that is almost certainly not going to be a blood clot, and that's an almost expected reaction. And patients will always get written information about what to expect, what the common side effects are, and we'll definitely publish that at the end of this forum. Ben might want to add a bit more to that. No? Happy with that, Ben?
I think you've totally covered it, Dr. Jonathan. That's absolutely right. That's what we tell people, and that's the right message.
Great.
Great. Thank you. And I think just one additional question that's really come up consistently, certainly again in many of the conversations I've been having. There's a real concern about I guess, the efficacy of the vaccine for Indigenous peoples and how widely it's been tested on Indigenous people globally. And so I'm sure you can, as an amazing panel, understand the concerns there, the feeling that the Aboriginal community in particular has been poked and prodded and tested and used as guinea pigs previously. And so I think there's some concern there that perhaps we might be used in a similar way this time round. So I'm just wondering, Ben, if you're able to kind of speak to any kind of knowledge we have about the vaccinations on offer and the impact that they've had on any Indigenous populations around the globe.
Yeah, Nicole, thank you so much. Such an important question. Unfortunately, I don't have a great answer for it. What I will say from the perspective of, people's concerns in this space, I absolutely acknowledge that there's a history of real abuse and trauma associated with the misuse of health systems and the misuse of medical research in a range of First Nations peoples globally, and I totally acknowledge people's concerns in that space. Secondly, I would say I am not aware of any specific data on research being done on the effectiveness of these vaccines in First Nations peoples globally, or indeed in Aboriginal and Torres Strait Islander people here in Australia, in terms of whether there's a difference in how the vaccines work. I don't have an answer for that. What I can say, and I'd be really interested in the perspectives of the other panelists as well, is that while we don't have specific answers to those, when we look at these vaccines and they're used in very different populations, so whether that's in different European countries, whether that's in Africa, whether that's in different populations in North America, in South America, the vaccines work in all those communities. There are differences based on strains of vaccine, but we're not seeing differences based on the people who are actually getting vaccinated. And my real concern, and I guess the communication challenge here, is we need to be able to discuss with the community that while we don't have specific evidence of it, of effectiveness specifically in Aboriginal or Torres Strait Islander people, to not vaccinate and give the benefit of these vaccines to Indigenous peoples would lead to a very significant risk of future loss of life and of real health problems. So when we look around the globe and see these vaccines working so well, how could we not offer it to Indigenous peoples to protect their health while we do the sort of research you're talking about, noting it's really hard to do effectiveness research in the really fortunate position we're in, where there's no COVID transmission ongoing in the community here in Australia. So that's really my perspective, but I'd be really happy to hear that of others on the panel and other people.
Jill, are you happy to comment?
Look, I am no scientist or health expert, but I do agree with Ben in the thinking around that. Why would we as Aboriginal people be denied access to anything solely because we haven't been included in the research, is what I'm trying to say bluntly. So I think, I mean, were we included in the research when we were doing the flu vaccines, the measles vaccines? Probably not. So that's my thinking as a lay person. And I would hate to think that we would not offer the same as any other citizen.
Great, thank you. And I appreciate we're coming close to time. So I do think there is a really important question that's come up in the Q&A function on the side, which I can see that Ben and John have obviously provided a response to, but I do think it's important just to kind of touch on some of that, which is particularly around where's the positives of having the vaccination. So Ben, are you happy to kick off around that?
Yeah, really happy to kick off on that, Nicole. And I'd be a pretty poor senior medical advisor for the immunisation program if I couldn't come up with a couple of answers for that one. So thanks for the opportunity to see if I keep my job. So look, again, this is a little bit harder to sell in an environment when we don't have people dying of COVID every day. And thank goodness that we don't. Honestly, that's down to the Victorian community and to the Australian community for pulling together, staying apart, being COVID safe and doing all those things that are so hard, but have made us the envy of the world, honestly, where we are right now. Let's think about our poor sisters and brothers in India right now, or Brazil, or South Africa, or in fact, most of the world, including Europe, United States, Canada, where they have been trying to roll this vaccination program out at the time that they're having thousands and thousands of people losing their lives from COVID every day. And when they've done that and rolled this out, I'm thinking of places like Scotland, I'm thinking of places like Israel, even the United States, we have seen the numbers of people losing their lives plummet, and much more than we would expect to have seen based on just the public health restrictions that had previously been used in previous waves of COVID-19. You know, in the UK alone, they think in the first 3 months of the vaccine program, 6,000 lives were saved, really in the early days of the program. And as I put in the chat, if we look at the Scottish experience, there was a 94% reduction in people going to hospital for those who had got AstraZeneca vaccine compared to those who hadn't been vaccinated yet. 94% reduction. And that's when they had the UK variant circulating. So again, I know it's not all about numbers and figures and stuff, but honestly, we see these vaccines saving tens of thousands, hundreds of thousands of lives around the world right now. And this is part of what we need to do to protect our community as we go into winter from having that sort of devastating experience. Goodness, we all hope not, and we'll do everything we can to prevent that from happening. I know we will, but the vaccine's a big part of that. And it also, apart from the health benefits in relation to COVID, it means we stay open. It means we can visit our families. It means we can go and hang out with our friends. And do all that really important emotional and mental health stuff that COVID stopped us from doing. So that's how I would start the conversation. But I think there's a lot of other benefits we could talk about.
Great, thank you. And I'm conscious that we've come to time, and I feel like that's gone incredibly quickly. I'd really just thank our panel for your comments. I know that this won't be the end of you receiving a broad range of questions from our community that are obviously, I guess, still making a decision about the vaccination. I think, as we touched on throughout this, really the strength of the Aboriginal community has obviously been our cultural ways of knowing, being and doing, and obviously that innate responsibility for protecting each other. So I'm sure once we get going, I'm sure we'll see our vaccination numbers increase from there. Look, it's important, I guess, from here that if you do have any more questions, certainly about the vaccination, that information can be found through your Aboriginal Community Controlled Health organisation or your local GP. Further information can also be found on the Q&A chat. There's been some links shared there. And I think just remembering that community who are eligible can get vaccinated at participating GP services at one of the high volume sites that Ben spoke about, and they can be found on the Victorian website. And as Aunty Jill pointed out, we and Dr. John, we've got an amazing Aboriginal community controlled, number of Aboriginal community controlled health organisations that have really got themselves organised and ready to assist and vaccinate. So I think plenty of places that we can, seek additional information. Once again, my sincere thanks to our panellists for this evening, for all of you for attending, and thank you so much. Wishing you all the best.